October marks Breast Cancer Awareness Month.
It's a good reminder that early detection can save lives, and here to tell us what we should keep in mind is Dr. Deepa Halaharvi. Doctor, welcome in. Great to see you again.
Great to see you too. Thank you for having me back again.
Yeah, absolutely. Dr. Halaharvi, we spoke to you last year about your experience with breast cancer diagnosis. Remind our viewers here what that experience was like for you.
Yes, so I was diagnosed with early stage breast cancer on a screening mammogram. And screening mammogram does decrease the death rate. So it is something that we recommend for women who are considered average risk, meaning they don't have family history of breast cancer, they're not considered high risk. We recommend them getting a screening mammogram once a year, starting at age 40, and every year.
And there is a trend of younger women being diagnosed with breast cancer. Sadly, I know many people in their 30s who have been diagnosed. So why is that concerning for you?
Yeah, unfortunately, I have a lot of young patients in my own practice. 25% of the breast cancer that's diagnosed is under age 50. There's a number of different factors for that. There's a paper that just came out in JAMA that talks about obesity being a risk factor, as well as reproductive history, meaning women are delaying their childbearing, are not having kids, and you're not breaking the estrogen cycle, so that can increase your risk of breast cancer. And the other things, of course, diet, lifestyle, environmental pollution, and also starting, again, going back to reproductive history, early periods or having late menopause, obesity, we tend to store estrogen. These are all risk factors. And younger women these days are putting off having kids or not wanting to have kids. That's definitely a risk factor.
Doctor, what age should women get their first breast cancer screening?
So for an average risk woman, they should start getting a mammogram at age 40.
Okay, so, and I think for a lot of people that still comes as kind of a surprise. 40 feels pretty young,
Yes.
And so hearing that, people might say, wow, it's already time. What are some symptoms that you need to look out for also? If maybe you haven't reached the mammogram stage, maybe you're between mammograms, what are things that could signify you need to get a closer check?
Yeah. So a lot of these young women, especially women younger than 40 who haven't had a mammogram, typically come to me with a mass, with the breast mass. So the common symptoms of a breast cancer could be a mass that feels really firm on when you check yourself, nipple discharge that's like clear or bloody, or puckering in the skin or the nipple, enlarged lymph nodes underneath the arm. There's also what's called inflammatory breast cancer, which presents like mastitis with inflamed red breast that has what we call podorange, is just a word for orange peel appearance. So it's really important for women, regardless of how old they are, to be aware of their breast and to do a breast exam once a month. For premenopausal women, a week after the periods, and for postmenopausal women, it would be same time every month, once a month.
What advice do you have for women who have recently been diagnosed with breast cancer?
Yeah, so we have about 300,000 women will get diagnosed with breast cancer this year. Most of the time, this is early stage breast cancer. The prognosis and survival is really great if they get diagnosed at early stage, meaning mammograms do catch cancer very early at a smaller size, earlier stage, which means better survival, better prognosis, less chance of needing invasive surgeries, and also maybe no chemo or less invasive chemo. So, and also the other misconception I want to clear is women will say, I don't have family history of breast cancer, do I need to be getting mammograms? And actually 85% of the women who get diagnosed with breast cancer don't have a family history. So you absolutely should be checking yourself once a month and getting an annual mammography starting at age 40.
Yeah, I think every one of my friends who have been diagnosed in their 30s had zero family history of it. And so it really, what we thought we knew years ago about breast cancer, not always the case.
Very interesting, and also promising too. Early diagnosis can really make a big, big difference. And we're glad that you're doing well too.
Yes.
Good, Dr. Halaharvi.
I'm doing wonderful.
Yes.
Thank you
So glad you're doing well. All right, well.
Thank you so much for having me.
Yeah, don't be a stranger. Come back and see us sometime, all right?